When you think about individuals that have to be on those front lines, it's not just our personnel that are doing direct patient care. It's also our housekeepers, our registrars, our people that have to go in each and every day to provide crucial services. We wanted to make sure that whatever we did as a system, and that our patient experience and our staff experience during COVID-19 were the same. The activation of Incident Command was actually as a result of our supply chain noting shortages in personal protective equipment.
Long before we started sending up tents and things like that, we decided to just take a proactive stance and start ordering product then. And it's worked out really well. Nobody here has needed anything that we couldn't supply them. I don't want anybody to say, you know what, I didn't have what I needed when I needed it. And to this point, not one person has had to say that.
Once we activated Incident Command, I went to 7 days a week. It was a very stressful time from the perspective of we couldn't afford to miss anything.
We felt that something was happening, so we pulled together and started doing what-if scenarios. We had identified earlier that we need more bandwidth. We reached out back in February and contacted our vendors and asked them to put an order on hold for us. Boy, we're fortunate that we did it, because as soon as COVID hit, literally there were 3-month wait for equipment. And we already had it in the pipeline and pulled the trigger and got it here very quickly. Prior to COVID, in January and February, we did approximately 1,500 to 1,700 telehealth visits at that time. March, we ramped up to about 30,000. April, we're up to 37,000, significant increase, which allowed us to provide care to our patients who could not come in.
Thank you all for joining. So I'm going to mute everybody, and I'm going to get the music going, and we'll get rolling. I have a home gym, which has allowed me to teach fitness classes comfortably and deliver them to people through Zoom. Before it was very small, I was using the gym at the hospital. So I had to limit it to 7, and it was 1 day a week. So now I'm personally teaching 3 days a week. Physical activity helps manage stress, helps manage depression, anxiety, in addition to keeping your body well. So I feel like me offering fitness classes is really just giving them another opportunity or another tool for their own wellness.
I think that one of the most important things that people need in their lives is to know that they matter. And so that's what I'm doing.
How are you today?
Because of COVID, they were not going to have groups here on site, so they were going to actually instruct through Zoom. I said to my supervisor, put me where you want me. Where I am right now is I am out at the employee entrance. I greet folks as they come in during the day. I've decorated with butterflies all throughout, and I have a beautiful flower arrangement of roses and peonies. You know, you want to wrap around that feeling of we care.
Infection control is number one. Keeping all of us safe is what we do, and that starts from the top of the room to the bottom on the floor. The women on our team are awesome, and we've all been trained really well, but now we've had to put on PPE to protect ourselves and to make sure that the cleaning that we're doing is the best that it can be. Going home at the end of the day, kind of hoping and praying that I've got every spot, I've hit every corner, I've protected myself while I was doing it, weighs a little bit heavy. Am I bringing it home to my husband? Those are the kind of things that have changed.
I think of what I do as being a part of the team here. You know, I'm just doing a little part of what everybody is doing during the day.
It is in my blood to help others. I want people to be better and be well.
We do this for a reason, same as anyone else in the organization, to take care of our patients. We support, the whole organization, and we're proud to do that.
I feel humbled to know how to do this. That's my part in all of this.